Namaste. Good morning. Good morning. So welcome you all to the day 5. 4 दिन निकल गए. Yes. Hope you have done some of these exercises as a practice and help yourself to get rid of knee pain, stiffness in the knee, hip region. So in 4 days, we have covered the range of exercises for you. You can have the combination of that for yourself where you can get rid of the challenges what you are struggling with. हम्म, तो अलग अलग प्रकार के हमने एक्सरसाइजेस पिछले 4 दिनों में पता किया है and whatever you feel comfortable in doing, definitely you should choose doing that. And along with that, we can take advice of the expert for specific set of exercises for the specific conditions. ठीक है, तो कौन कौन से कंडीशन के लिए कौन कौन से एक्सरसाइजेस, दिस सेट और द सीक्वेंस ऑफ एक्सरसाइजेस, दैट आल्सो वी विल एक्सप्लोर. Yeah, I want to know from you that how many of you are doing continuously for last 5 days. आप में से कितने लोग हैं जो पिछले 4 दिनों से ज्वाइन कर रहे हैं और आज उनका 5वां दिन है. टाइप 5 इन द चैट एंड लेट मी सी. अगर आप आज का चौथा दिन होगा तो यू कैन टाइप 4. आज का तीसरा दिन होगा यू कैन टाइप 3. आज का पहला ही दिन होगा डोंट वरी यू कैन टाइप 1. लेट मी सी. Yes, wonderful. So I can see the mix of 4, 5, and 3. And some people put 1 also. Great. And another question I want to ask you that what benefit you see joining at 5:30 a.m.? Yeah, so what benefit you see when you attend this class at 5:30? सुबह सुबह 5:30 बजे उठ के आप ज्वाइन कर लेते हो, तो इससे क्या फायदा आपको महसूस हो रहा है for yourself? Can you put in the chat and let me know for that so that I can inform our expert also accordingly? Preeti is saying it's the best time of the day to do exercises, less pain in the knees. Okay. It is convenient time to join and the legs are feeling exercise gently. Yes. Okay. It is helping in the flexibility in the knees. Feeling good. Oh, getting up in the Brahma Muhurat, added advantage, along with the knee exercises. Interesting, better feeling, less knee pain, more angry. What it means? Feeling good, great. Feeling relief in the knees. Early morning schedule get up, okay? So, what's to express the abundance, okay? Yeah, less pain in the knees. Hmm. How many are feeling there is some change? आप में से कितने लोग महसूस कर रहे हैं कि देर इज सम चेंज हैपनिंग फॉर यू व्हेन वी आर डूइंग दिस एक्सरसाइजेस? हाँ, टाइप मी इन द चैट हाउ मेनी ऑफ यू आर फीलिंग लाइक दैट. टाइप मी इन द chat how many of you are feeling there is some change I am observing for myself. Oh, there are so many of you. Ah, much relaxed. Yeah, very good feeling. Okay. So consistency matters, in these 7 days, we will get to know different variations of the exercises for the relaxation of the knees, but we need to practice it for some duration of time. Then only we can figure out कि whether you are doing whatever you are doing, whether you are encashing the result of it or not. तो जो भी हम कर रहे हैं, उसको थोड़ा कंसिस्टेंटली हमें करना पड़ेगा, so that you can get benefit in the long run for yourself. Yeah. Okay, so let me check with the expert whether the OJS sir is here or not. Yes. So till our expert join, let's do a quick recap of all the exercises which we have done till now. आज तक के जो भी पिछले 4 दिनों में हमने एक्सरसाइजेस किए हैं, एक बार उसको क्विकली हम गो थ्रू करते हैं, एंड देन expert can take on. Okay, so first day we got to know the ankle pumps. Okay, just the movement of the um, पैर का जो पंजा है उसका मूवमेंट हम कर रहे थे, फ्रंट एंड बैक, राइट. देन आफ्टर दैट, नी फ्लेक्शन और एक्सटेंशन रेंज ऑफ मूवमेंट, वेयर वी आर मूविंग आवर नीज फ्रंट एंड बैक. Okay, after that we got to know the bridging exercises, where we are lifting our bum at the back, और फिर इस तरीके से ब्रिज बनाते हुए we were holding our position for 8 to 10 seconds. Then arm stretch. Okay, so in the arm stretch what we were doing, so we were holding our जो हमारा पैर का पंजा है उसको we are holding with some rubber band or दुपट्टा or something like that, and we are stretching it. उसको हम अपनी तरफ खींच रहे थे. फिर calf stretches. So it's also same like arm stretches, but calf stretches में हम calf पे ज्यादा फोकस करते हैं, right? Then we got to know the ankle and knee range of movement exercises, where we are moving the knees and the ankles in particular direction. तो हम rotation करते थे. फिर breathing exercise that we know, and hamstring and calf stretch. So this is kind of the repetition for the second day. In the third day we got to know range of motion exercises for 10 repetitions. Then quad isometric exercises, where we are putting so you can see here, so we are putting the towel or soft pillow under your knee, and we are pressing our heels, so like this. Then heel press, so where we are putting our the towel at the knee area, at the heel area, and we are pressing it like we are holding for some duration of time. Okay. Then adductors isometric, where we are holding the towel in between the knees and pressing that area. ठीक है. तो क्वाड आइसोमेट्रिक में हम क्या करते थे कि नी के नीचे हम कोई भी पिलो या फिर आप टॉवेल को रखें, फिर वी वर होल्डिंग दैट हील एरिया. तो अपने पैर के आगे वाले पोर्शन को हम थोड़ी देर के लिए होल्ड करके रखें. फिर बाद में हील प्रेस में हील के नीचे हम ये जो भी पिलो है या फिर आपका उसको हम होल्ड करके वी वर होल्डिंग दैट फॉर सम टाइम. देन adductor isometric, where you are holding uh, the towel in between the knees, ना दोनों इसके बीच में हम रखते थे. देन फोर्थ इसमें हमने रेंज ऑफ मोशन एक्सरसाइजेस किए, Got isometric किए, heel press किया, this is the heel press, and then adductor isometric. This we did. So our expert is here now. Hello, sir. Welcome.
Thank you.
Thank you.
Good morning, everyone. Namaste.
Namaste. Yeah, so over to you. I was just revising whatever we have covered in last 4 days so that everyone can be on the same page. And then over to you, sir, for today's wonderful session. Yeah.
That's really nice. A good revision is very necessary. So, moving forward with today's day, we'll be doing certain new exercises. So, we'll be introducing a new variation in warm up. We'll not be doing the range of motion exercises today. We will be doing a different kind of dynamic warm up exercise, and that will be on the spot marching. And then we will proceed to two other exercises which will help us in increasing our strength in a dynamic way. So you can have your exercise mat ready, and if possible you can also have a Theraband with you. It is not very absolutely necessary, but if you're having it, it will be good. So moving forward, we will begin with on the spot marching. You can be in a standing position like this. Be in a comfortable standing position. Keep hands by your side, and we will start on the spot marching. Your elbows can be either bent or they can be straight as per your comfort and convenience. And you should be standing erect. Now, I am demonstrating with elbow bent, and we will go for 20 to 30 repetitions of this exercise at one time. सो एक ही जगह पे खड़े रह के हम ऑन द स्पॉट मार्चिंग करेंगे एंड 20 टू 30 रेपिटेशंस तक हम जाएंगे. इसका पर्पस ये है कि हम वार्म अप एक्सरसाइज कर रहे हैं, तो सारे जॉइंट्स में एट अ टाइम वार्म अप होगा, एक सर्टेन वार्मनेस डेवलप होगी जो कि एक बेसलाइन बनाएगा जो हम फर्दर एक्सरसाइजेस में यूज करेंगे. सो लेट्स स्टार्ट. 1 2 3 4 5 6 7 8 9 10 11 12 13 14 15 16 17 18 19 and 20 21 22 23 24 25 26 27 28 29 and 30. So this can be up to 30 repetitions in one stretch. Now you can take a break, put your hands by your side and relax. 20 to 30 सेकेंड्स तक आप एक स्ट्रेच में कर सकते हैं एंड उसके बाद ब्रेक ले लीजिए कुछ सेकेंड्स का. इसके बाद एक और बार हम सेम रेपिटेशन कर सकते हैं. जिन लोगों को थोड़ा सा फटीग फील हो रहा है, इफ यू आर फीलिंग एनी फटीगनेस, इफ यू आर फीलिंग टायर्ड और ब्रेथलेस, you can take a rest for some more time, or else you can decrease the number of repetitions. Maybe you can do 10 repetitions at a time and repeat it thrice. So it will be 30 repetitions. So now beginning again with another set of this exercise. 1, 2, 3, 4, 5, 6, 7. So I'll be demonstrating this in a side standing position so that it is clear to you. My hand and knee movements are clear to you. So 1, 2, 3, 4, 5, 6. Here it is important to see that your knee will be bent slightly and your elbows can be bent or they can be straight like this as well. Again, according to your comfort. 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, and 20. You can have a rest, put your hands by your side and relax. So if you had your elbows bent while doing the marching exercise, you can then straighten up your elbows and keep your hands like this and stand relaxed. If you had your elbows straightened during the marching exercise, you can put your elbows in a bent position like this and keep them supported. Take rest for a few seconds. So you will notice that it will bring certain amount of fatigue or tiredness or maybe breathlessness. It is very normal if you are not habitual of this exercise, but it acts as a good warm-up exercise for the whole body and all the joints of the body in general. Also, it is very good for your knee muscle coordination with the nervous system. So it is a good exercise for developing a rhythmic pattern of movement. Often in cases of osteoarthritis or other arthritis around the knee or other knee issues, it is often very important to develop a good rhythm of movement than the strength of movement. So this exercise of on the spot marching, this helps in achieving a good rhythm of movement and will help you achieve an easier walk, an easier stair climb. So this you can definitely invest upon. Now we will move on to another exercise, which is called straight leg raising or SLR. This will require us to have a lying position so you can utilize your exercise mat and be in a lying position, that is lying on your back. आपको सीधा लेटना है अपने कमर के बल एक्सरसाइज मैट के ऊपर. आप कंफर्टेबली लेट सकते हैं जैसा कि आप देख रहे हैं. आई एम लाइंग ऑन माई बैक. सो व्हाट वी विल डू इज we will raise one leg at a time and my ankle and foot will be directed towards my own self. So I am directing my foot towards myself and then I will lift my leg up like this. So the extent of raising, it can go up to this extent or this extent or this extent. It will depend upon your strength, your agility, and so many other factors. So go to the extent to which feels natural to you, in which there is comfort and not much of pressure, right? So we will do one leg at a time. I am first demonstrating you the left leg. So for the left leg to be raised like this, it will be easier for us to raise the left leg if we bend the right knee, right? So I have bent the right knee. मैंने अपना राइट घुटना मोड़ लिया है. अब मेरे लिए आसान हो जाएगा कि मैं लेफ्ट लेग को रेस कर पाऊँ. तो मैंने लेफ्ट लेग का एंकल अपनी तरफ किया एंड इसको रेस किया. सो मेरा जो नेचुरल बॉडी सिस्टम अलाउ कर रहा है वो इतना लेंथ अलाउ कर रहा है रेस करने के लिए. नाउ आई विल होल्ड दिस पोजिशन for a period of 10 seconds. So I will count it verbally. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Now I will bring it down and put both the legs in a straightened manner. You can decrease the number of repetitions as per your comfort. It can be as minimum as 5 repetitions also, or you can go for 8 number of repetitions or 10 as per your comfort and convenience. Now I will repeat the same in the right leg. So I will bend my right knee like this. Now I will place my right ankle towards myself and lift the leg up. I will count verbally 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. I will bring it down. My foot is directed forwards. I will also straighten the other leg. So this is the way which will be followed for doing the straight leg raising or SLR. You have to do one leg at a time. If you wish to do one leg in one stretch, let's say 10 repetitions of one leg in one go, you can also do that with breaks in between. or you can do in an alternative fashion like we are doing. So again, I am going for the left leg, raising, bend the right knee and lift the leg up. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Bring it down, point the foot forward, relax. Now bend the left leg, lift the right leg, count 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Relax both your feet and legs. Relax in the lying position. If you feel any kind of stress at the level of knee or around the knee while raising the leg, you can just tilt your leg slightly outwards. So it will be difficult for me to demonstrate in a lying position. I will first attain a seated position and will demonstrate. So let's say if you are raising your leg in a lying position and you are raising it in a straight manner, but it pains here or is it straining here, then what you can do is slightly turn your leg outward like this. It will be easier for you then. So we will move forward with another repetition of the same exercise. Attain a comfortable lying position. I'm lifting my left leg. Bent is right leg. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Now I can move on to the right leg, lifting my right leg and bent is my left leg. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Bring it back, lift the leg up, left leg up like this. Your foot is towards yourself and count again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Bring it down, relax. In between these repetitions, you can go without breaks also. You will have to listen to your body signals. Sometimes it will allow you to go in one momentum without breaks, and sometimes you will need breaks in between. So you can go as per your body signals. Now I am going to lift my right leg. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Right? So we are done with straight leg raising activity. Relax both of your legs. Be in the lying position. Focus on your breath, or else you can focus on your belly area around your navel. This will help you center down your, cool down your breathing rate. It will be good for your relaxation. You can place both of your hands like this in a crisscrossed manner above your navel area. So now we are done with this exercise. We can now shift to other exercise, which we call as a clamshell exercise. So in clamshell, the starting position required by you will be a side lying position. आपको करवट के बल लेटना होगा इस एक्सरसाइज में, जिसको हम क्लैमशेल बोलते हैं. इसमें हम क्या करेंगे, पहले मैं करवट के बल लेटूंगा, मेरे घुटने मुड़े हुए रहेंगे. I can use my other hand for my headrest, or else you can use a thick pillow so that your neck does not bend down. This is the starting position. What we have to do is we have to lift the upper leg up like this, hold it for a period of 10 seconds, and then bring it back. What this will do is this will strengthen your hip abductor muscles or the muscles in this area, which means that once they are strengthened, it will be good for you, good for your body balance. In patients with knee pain, often balance is affected, and you see the legs or knee turning out. So it is very important to prevent falls, to maintain a good body balance and body coordination. So we will be proceeding with this clamshell exercise. It will be good if you can have a Theraband like this, which is elastic. So you can use that. It adds to the resistance part. But even if you don't have, then we can do without it also. So I will demonstrate you both ways. Once I will use with this Theraband and without Theraband. So I've placed the Theraband. I am attaining the starting position of this exercise. I am resting my head. You can use a thick pillow to rest your head and then do like this. Lift your upper leg up. Hold this position. You can use your other hand to take a rest like this. Count for a period of 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And relax. Bring it down. Again, it is very important that you can decrease or increase the number of repetitions as per your comfort, and same goes for the holding period. So if we are doing a holding period for 10 seconds, it is not necessary for everyone to do for 10 seconds. It can be 8 seconds, it can be 5 seconds, or as minimum as possible. As per your body allows you, you can go ahead with that. Now we will do another repetition of this. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Relax. You have to do it both sides. Since I am using my left leg up this time, you have to do it right leg up also. But I will not be able to demonstrate you right leg up since it will be my backside in that way. So I will only demonstrate this way. But for you, it should be for both the sides. So again, repeating, lift the upper leg up. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Take a break, relax, and again repeat. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Relax. You should expect some amount of pain or fatigue here on the outer side of knee or on the outer side of your thigh, as you are trying to build some resistance in your thigh muscles or muscles around the knee. So adding resistance to it, if you are using Theraband, expect some amount of pain. In some people, pain or fatigue sensation will also arise without the Theraband. So it is natural for day one. With practice, it will improvise. Now what I will do is I will attain a sitting position, remove my Theraband, and then we will again repeat the exercise without the Theraband. So notice my lifting technique. This should be the correct lifting way when you change position from a lying to a seated position. What you do is you first take a side lying position. आप करवट लेके पहले लेटते हैं and then उसके बाद उठते हैं. This is the correct way to get up, especially for patients with pain in the low back area or spine. Now I will do the clamshell exercise again without the Theraband. So a side lying position, करवट के बल लेटना है आपको, and my knees are bent. So lifting your upper leg up. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. relax, bring it down. Again, I'm repeating, for patients with high blood pressure, you can decrease the holding period to 3 to 4 seconds. You are not required to do it for up to 10 seconds. Again, repeating, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. The extent to which you lift your leg up, it may vary from person to person. So for people who are having adductor tightness or muscles of the inner thigh, if they are tight, then it will not allow you to increase the height very much. So allow yourself as per your comfort, as per your body allowance. Again, repeating, lift your upper leg up, count for a period of 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now I will repeat the exercise for population having high blood pressure. We will attain a side lying position, be comfortable. It can be supported with the other hand. My knees are bent, and I will lift my upper leg up and hold it for a period of 3 to 4 seconds. Lifting it up, 1, 2, 3, and 4. Bring it down, relax. Again, you can take a thick pillow beneath your neck so that your neck does not bend down. Lifting it up again, 1, 2, 3, and 4. Repeat it again. Lift it up, 1, 2, 3, 4. Relax. Now you can have a sitting position. So this way you sit up from a lying position. So we are done with the exercises for today. We did warm-up exercises in which we did on the spot marching. We attained a comfortable standing posture, and we did on the spot marching like this, repetitive movements in a rhythm. This establishes good rhythm of neural and muscular tissue. So establishes a good body balance, prevents you from falls. Then we did straight leg raising, in which we attained lying position. We bent the other leg and lifted the opposite leg and hold it for a period of 10 seconds. Then we did clamshells in a side lying position, in which the knees were bent and we lifted the upper leg up and holded it for a period of 10 seconds or 3 to 4 seconds as per the audience. So that's it for now. We are done with today's exercises. I am open to queries if there are any.
Yes, thank you so much for wonderful demonstration of all the exercises and uh, helping us know about today's sequence, what we can follow. There
My
are some
pleasure.
questions which I would like to take from the audience, which they ask. Can we avoid operation by these exercises?
So it cannot be generally said about avoidance of any operation. It depends on the severity of your knee condition, severity of the arthritis. There are different grades in the X-ray. Depends on which grade you are into and how much difficult for it is for you to carry your daily activities. So there are so many factors. But yes,
Mhm.
definitely these exercises will help you delay the surgery part or help you delay the progression of disease.
Any diet restrictions the person should follow if we are doing these exercises?
No specific restriction is there, but generally you should be empty stomach so as to avoid any kind of gastric reflux or vomiting.
Yeah. After doing knee mobility, my left knee is paining persistently. Do you suggest me anything?
So take a look at the number of repetitions and holding period. If you are doing it correctly, if it is suiting you, maybe you need to alternate the number of repetitions. Maybe you need to take frequent breaks in between. For now, since it is paining too much, you can take a break, avoid the exercise for a day or two, and then you can begin that after a break of 1 or 2 days.
Yeah. The position of the Theraband, does it matter on the knees?
Sorry.
The position of the Theraband.
Mm-hmm.
So should we put in particular position or just for the flexion relaxation it is needed?
No, the correct position for Theraband is I will show it to you. So this is my Theraband. Correct position should be around the at the knee level only, just slightly just above the knee, right? My lower thigh portion. It should wrap the lower thigh portion around. This will be the correct position because we are trying to build resistance in the outer part. So if you tie the Theraband somewhat above at this level, it will not be much helpful. So you have to wrap it at the lower thigh level.
Yeah. So if I have pain in one leg, one knee, then should I do these exercises more for that leg?
Yes, you can do for that leg more number of repetitions, but there are other factors as well. Since we are not knowing the exact cause of your pain in that leg, it depends according to the cause of the condition. If it is a muscular cause, if it is a muscular weakness, particularly the outer side muscle weakness, then yes, you can go for more number of repetitions on that side. But it in general, if it is not that cause, then you need to have a balanced approach for both the legs.
While lifting the leg, getting the cramps, please advise what should I do?
So if you are getting cramps, maybe you can decrease the holding period. You need not hold it for a period of 10 seconds. You can decrease it to 5 seconds as well, or maybe less than that if required. Notice your body signals, and also it will be advisable to take appropriate electrolyte solutions like ORS somewhat before the exercise if the cramps are very frequent.
Okay, wonderful. We have to do all 5 day exercises every day.
It is not required to do them every day. You can plan it alternatively. So specifically for bridging, you have to do it alternatively. The knee joint range of motion exercises, they can be done daily. For isometrics, you can plan it alternatively. And for the dynamic resistance exercises, which we did today, these you can plan alternatively. So one day you can do isometrics, one day you can do dynamic resistance, which we did today, and alternative days, bridging exercises. But the knee mobility, ankle mobility, hip mobility, they can be done daily.
What is the reason that the BP person should not do more of these exercises?
Okay. So the reason is that any kind of holding period, when we hold the, sorry,
No, go on with the answer.
so any kind of holding period, it increases the blood pressure. So any kind of holding is basically an isometric exercise. So by isometric, we mean that the movement is not physically happening, but muscle contraction is happening. Just like we did quadriceps isometrics or heel press exercises, there was no physical or visible movement happening, but you were able to feel the muscle contraction. So such exercises are called isometric. So in such exercises in which there is holding and no physical movement, then the BP rises. So since you are already having high blood pressure or hypertension, so it will be advisable that you hold it for a less number of seconds.
So thank you so much for another wonderful session for all our users. And tomorrow again we'll meet for next set of exercises with Ojas sir, and explore how we can get rid of the knee pain or the challenges which we are struggling with, and help our knee to safeguard with such simple gentle movements of the knee for ourselves. Yeah, thank you
Surely.
just for your time. Any suggestion for the users?
Yeah, you can practice these exercises for the day. And if there are cramps or there is muscle soreness after the exercises, you can take cold packs multiple times a day, each time 10 minutes duration. And do practice marching exercise. You can practice marching multiple times a day. At least you can practice up to 3 to 4 times a day. Marching will help you attain a good warm up, attain a good neuromuscular coordination, attain a good balance, and also prevention of falls. So, your task for the day is practicing marches, on the spot marches, 3 to 4 times today.
Yeah, thank you so much. And you will receive the recording of the session. If you have any specific question, you can type in the question link along with the recording. Yeah. If you didn't receive the answer, don't worry. We are covering that here in the session. Also, some of the questions are getting covered. Yeah, and for some users, definitely you will receive in your personal chat according to your conditions. Okay. Thank you so much for joining, and see you tomorrow, same time. We can have a next set of exercises for all of us for get rid of the knee pain and creating the comfort for it. Okay. Yeah. Thank you so much. We can log in for the yoga now, yeah, with Saurabh. Bye bye. Thank you, Ojas sir, for your wonderful session.
My pleasure. Take care. Namaste.
Namaste.